Hello, everyone. Thank you for joining in. Good morning from this side. Kindly confirm that you can hear me. Am I audible? Welcome to this live. Please confirm that you can hear me. Okay, yes. Thank you, MJJ. Thank you. Thank you for the feedback and thank you for the like. Thank you for the votes. Everyone joining in, I want to welcome you specially to this live. And then it's been a while coming live on the channel. It's been quite engaging period for me, clinical work. But we have to do this again and again, showing up in the community. So how have you been? If you are joining us for the first time, this is a health, wellness, and lifestyle channel. There's something that connects us, and that's our health, and that's important for increasing productivity. Having a good health, definitely essential. And I want you to join us. I'm inviting you to join the community. Kindly subscribe, and that way you can get information, regular updates on the channel and the activities. MJJ says, hello, doctor. MJJ, thank you. Hi, Kristen All. Okay, Kristen All is asking, where am I from? Kristen, I'm from Nigeria, presently in Lagos, Nigeria. I like that question, Kristen. Kristen is asking, what can help with mental health? It's a very, very good question and a very important one at that. Okay, mental health really, it's one aspect of health that affects people globally, affects affects people irrespective of location, age, sex, or even status, whether you're rich or low income earner. Mental health is key. is key to functioning as an individual, living a healthy life. Is also connected to how mentally fit you are as an individual. So when you ask this question, what can help with mental health? Quite a number of things. Mental health is one aspect of health that relates with cognitive function, your emotional health, um, your feelings. In fact, even your sexual health is connected to your mental health. Okay. Interestingly, related to your sleep patterns, related to your feeding patterns. So your health really, we talk about the physical, the mental, and then the social aspects of our health. All these are interconnected. I'm sure many people who are actually community members know that. I like this definition according to the World Health Organization that says mental and social well-being, a state of complete physical, mental, and social well-being. So it goes beyond how you appear, even though really people's mental health can reflect in the way they appear. Okay, somebody can appear unkempt, can appear uh, emaciated, or may be connected to the mental health of the individual. So, describing this as an introduction to my response to that question, what can help? It means looking at different areas um, that are connected to this mental state of an individual. Okay, so when you talk about challenges with thinking patterns, interestingly, some people even hear voices when they can't see people around them. Some people have thoughts coming into their hearts, into their minds, um, like they are being thoughts being forced on their minds. So these are examples of mental health conditions. Somebody could be suffering from depression, loss of interest in the things that they will normally love to do, loss of appetite for food, may even be for sex. I talk a lot about sexual health, and then very important aspect. Some people uh, just lose interest in social life, withdrawn to self, and sometimes some people go into uh, not just being anxious to depression and then tendency to committing suicide. So these are mental health um, descriptions that I can give to you. Okay, some people actually suffer from panic panic attacks. Okay, some people have experienced a trauma at one time or the other, and then the memory is still there. So they have nightmares. They are not able to actually feel secured. Okay, so talking about help for a mental health issue, the first thing, Kristen, are you there? Kristen, the first thing is to actually make a correct diagnosis, identify the mental health condition. Is it depression? Is it anxiety? Is it a panic attack? It could even be sleep disturbance, insomnia. Some people, we talk about schizophrenia, so many, the extremes there. So being able to identify the exact condition is first of all important, and then knowing what is normal. Okay, because it's not normal for a person to be talking to self. Okay, now I'm talking to an audience. It's different from when I'm just talking, preparing for different, maybe a presentation. You can read to yourself, you can present and all. But when an individual is just walking and just talking to self and is doing that without a sense of purpose and direction, then they may be having some mental health issues. Okay, so if you are going to receive help, you must first recognize that there's an abnormal situation there. But what is normal is that individuals are communicating with others, you're interacting well with others, you feel safe around people, and you are able to relate with life correctly. So when an individual is missing on these areas, then they may not be fit mentally. Missing food, um, not just loss of appetite, avoiding to eat, or even eating more than usual could also be a mental health issue. So, having identified this, just giving these samples, what can help? We include checking the thought patterns. And when we talk about thoughts, they are actually connected to the things that we see, the things that we hear, to the things that you put on in your heart, things that you look and you meditate upon. These are the things that influence your your mind. So if you're going to receive help, you must have resources. For example, I'm sharing at this time, somebody somewhere in any part of the world, Christine, I hope you are still online. You will benefit from this. So this information is very important. And when someone, okay, thank you, Christine. Thank you for the feedback. So when someone uh, is able to expose themselves to correct information, okay, if an individual is able to recognize and find out ways by which they can receive what is positive to their mind, then they will definitely be having some changes in their mental positioning. Okay, a person is not well mentally positioned if they are not able to think properly, they are not able to communicate appropriately, if they are not able to perform their normal activities well enough, and interestingly improving at that. Okay, so a lot of things can cause it. Sometimes even people who have quarrels, offenses, they are mentally disturbed, worrying. Sometimes it could even be financial challenges, it could be marital, it could be career, it could be business, any there could be any trigger to this. Okay, but when an individual is able to identify and look out for resources, just like I've mentioned, one way to help is to seek appropriate diagnosis. First of all, you need to see a doctor to get appropriate diagnosis, because there are different mental health issues. Okay, but you need to be able to define it, because the management will definitely be different. The management of mental health conditions are different. Some may look similar, but most of the time, beyond medications, there's a need for some other forms of therapy, psychotherapy, and how we also help. So apart from resources, information that the individual receives, there must be a willingness, a decision that you want to move from your current experience to what you really deserve, because that's what God wants for us all. Yes, Lisa is here. Okay, I've been so engaged in this talk. Okay, Lisa Cooper saying, Dr. Shoyemi, good evening. Good evening. It's been a while, Lisa. Thank you for joining in. Hoping you and the family are doing well. Thank you, Lisa. Yes, if you are joining this live, kindly uh, double tap on your screen, and that will help the algorithm to know that you are getting some important information here, and then others can get to connect. Thank you for the like, and Kristen, thank you for the feedback. Thank you so much. She said, I will think about what you said. Thank you, Kristen. Kristen, you can subscribe to the channel so that you can have regular updates when show up on a live like this or upload a new video. Thank you. You're welcome, Christine. You say your words helped me so much. Thank you. Wow. Welcome, Christine. I'm glad that I'm able to help. Yeah. Okay. Thank you for subscribing, Christine. Okay. Where are you watching from, Christine? Or where are you watching from? Uh, let me know where you're watching from. And if you are joining us watching, let's know where you're watching from. And remember to uh, cast your votes at the poll and then double tap on your screen for the like. Okay, American, what type, where? Okay, trying to find out which part of America. Okay, United States of America, which part of America? Welcome, Christine. Okay, so I was talking about the need to look at different areas when it comes to managing a mental health condition or disorder. So, apart from the information, the user needs a will. There must be a decision, a wanting to change. That consciousness, that realization that there's a mental health challenge is important. There's something we call insight. If there is no insight, it's more dangerous than when the individual has insight that they have a mental health challenge. Very important. Okay, so I'm sure a psychiatric doctor will tell you this. Minnesota. Okay, welcome, Kristen. Thank you for joining us. I believe you're going to be finding the community very interesting. Okay. Apart from that willingness, there are other methods when it comes to mental health. You personally need to commit to doing things that will help you to overcome challenges. Sometimes these mental um, health challenges are initially subtle, and then the triggers are there. You can get the triggers off. You can engage in things that are positive, things that will help you to build up on your mental health, activities, social connections, like this connection on YouTube, for example, other social media platforms. Those are other means, even though some people suffer mental health challenges by interacting on social media. Okay, but um, you can maximize, you can use social media to your own advantage. Okay, when you have the positive community, positive people around you, learn to connect, learn to communicate with others, irrespective of location, okay, like you are doing right now. So, apart from the social connections, there is definitely a need to receive therapy. Okay, medications may be prescribed by your physician depending on his or diagnosis, and then the appropriate management, which may go beyond, will most of the time go beyond medications to psychotherapy, where you have sessions of counseling to, first of all, identify the situation and then taking steps for rehabilitation. Okay, many people have suffered a lot, and mental health issues are actually uh, of global concern. Sometimes there are discriminations. People who are identified as having one mental health issue or the other may be isolated, maybe maybe seen as outcasts, something like that, depending on the environment they are in. So, apart from those other points I've mentioned, there's a need for support. Support when it comes to support, talking about friends, family, uh, groups, communities. We need to give important support to those who having mental health challenges. Okay, so I also mentioned the need to eat healthily. Healthy eating is one way to help your mental health. They are the feel good hormones, and when you eat healthy, you will definitely find these hormones rising within you. I talk about not just eating what you like, but enjoying your food, enjoying your meal is very essential to a good mental state, mental health. So, food feeding is important. Sometimes deprivation from essential nutrients, vitamins may also affect an individual's mental health. So, eat well, balanced diet, and drinking, of course, water will go well, and then fruits and vegetables will be very helpful, supplying you with vitamins and then fibers. A lot of advantages to eating healthily, eating a balanced meal. Exercising is another factor that can help, another area that you should consider when it comes to mental health. This also help to build the feel good hormones. After exercising, you have your mood elated, you are uh, having good supply of blood to different parts of your body, your organs, even your brain. So you are able to have um, those functions, the cognitive function, the emotional function, all working well together. I believe I've been able to answer this question to an extent. Thank you, Christine, for engaging. Um, I hope you find this helpful. And if you need to actually consult with your doctor, I think you should do that. If it's not you, if you're asking this question on behalf of another, then they should seek proper medical attention, as I have given a general overview of how mental health disorders work and what to do. So don't people why do people actually avoid going to the doctor? That's our topic. Why people don't go to the doctor? There are some startling statistics. So I want to welcome you again, everyone. It's a powerful, eye-opening session on health-seeking behaviors. Okay, people have behaviors, and our behaviors are motivated by various factors, influenced by various things. So I don't know what influences you uh, coming on live. Are you a content creator? Okay, if you are, let me know in the comments. Some people are influenced by um, the motivation for finances, money, connections, power, different factors influence people's decisions. Even when it comes to health seeking, when we talk about health seeking, talking about decisions that people take, what people do when they are not feeling good in their bodies, especially it could even be mental health related. So, what do you do as an individual when you have a health challenge? What do you do? What would you like to say in the comments? So I can see within the last 1 year, some of the people who have responded to the poll say they have actually had a medical checkup. Very good. And then for the other group, it's been more than 2 years, 33%. Okay, so various factors actually determine how often an individual goes for a medical checkup. Okay, so even myself within the next, okay, within 2 years now. That's what I've done so far. So within next few months, I should have another general medical check. Yes, even your doctor should actually be having a medical checkup too. Very important. Okay, so people respond to illnesses in different ways depending on the kind of illness, depending on the time, depending on the age. So I believe we have adults here now. Okay, so but some people actually delay in seeking help when it comes to their health. Why do they do that? Why do they do that? Why do they do that? So, but let's look at this. Various facts. I'll just mention some to you. It said that only 60% of people worldwide with serious symptoms actually visit a healthcare provider. Only 60%. This is global statistics. 60% of people worldwide actually seek help when it comes to healthcare services. 60%. And those are people with serious symptoms. And even in low income countries, it's even worse. It's even less than 40% of people who seek health healthcare. Okay, so some people do googling, googling, whatever social media search engine that they decide to use to check out their symptoms and treatment. Okay, so some people do self medication. Some people actually do traditional medicine and all. Now, about the trends in Africa, 50% of people rely on traditional or spiritual healers first. That's where they go. And that is really causing a lot of harm and bringing in, causing more complications, people coming in with complications to the orthodox medicine. Now, delays in seeking medical care lead to late stage disease diagnosis. That's what happens. Some people uh, having tried different things, different traditional methods of treatment, even home remedies. Some people go as far as 1 year, 2 years before showing up. Excuse me. Before showing up in the hospital. Okay, and by that time, for some or most people, it's actually complicated, may not be fatal, it may be. Okay, so this will determine what is to be done next, excuse me, for such individuals. So it's getting cold around here. All right, so for Asia, it said that there's high use of home remedies. Asia, many things are available. Uh, emphasis on herbal and then home remedies and family advice. It said that rising digital health, use of telemedicine is happening more in India, in China. So people use these resources. In Europe and North America, more proactive health seeking behavior. Oh, yes, maybe because of a level of education, um, then the fact that researches are ongoing and funding, so many advantages why people are now proactive. There's information available and the health security system, talking about health insurance. This puts them at some advantage. Preventive services like screenings are used more by women. Okay, give it to the women. Interestingly, we find out that more women are seeking healthcare services compared to men. And then when a man does come for medical checkup, it's actually because there's a woman that has done a good job to ensure that that happened. Of course, not against the will of the man, but most times from my interaction with patients, you find out that um, it's either because the symptoms are becoming unbearable, or complications have set in, or someone around a man just passed on. So this provokes or pushes them to actually seek healthcare service. Okay, so it's important to note that more needs to be done by men when it comes to seeking healthcare. Thank you for the fifth like. If you are joining us, we are talking about health seeking behaviors globally. So it doesn't matter where you are, any part of the world, we're giving some statistics on how people, what influences people's decision on seeking healthcare. Now, there is a global gender gap, still talking about that. Women are 33% more likely to seek healthcare than men. 33% more likely to seek healthcare than men. That's interesting. So, what are your thoughts? What do you think from your experience? Are you a healthcare provider? Are you have you been a relative to um, someone that needed a doctor's involvement or intervention? And then what was your experience like getting them to seek this healthcare service? You can share with us. So, what are the things that can actually, let's look at that while I'm checking the comments. I'll talk about why people actually delay or avoid healthcare services. What do you think makes people, uh, or what are the things that make people to avoid seeking healthcare service even early enough? Why do people avoid healthcare service? Why do people avoid healthcare service? Okay, I'll start with this. The fear, the fear of the unknown. Okay, interestingly, some people already are conscious that they may be having a diagnosis. For example, if somebody is having frequency of urination, eating excessively, drinking water excessively, then from Google, even Google will help you to know that that's likely someone having symptoms of diabetes mellitus. So if an individual is afraid of having that kind of a diagnosis and yet they are having symptoms, the fear of not of getting that diagnosis will make them to stay away from the hospital or from seeking healthcare service. So that's one major one. What if somebody's thinking, what if it's something serious? What if it's something serious? Really, it becomes more serious when it's complicated. When these complications have set in. Okay, so interestingly, for some people, it may just be as in quotes as mild as urinary tract infection and not diabetes mellitus. Okay, so you don't get to know the diagnosis really until you get to see your doctor, have a proper history taking, and then proper examination and relevant investigations requested in some cases to confirm the diagnosis. So, cost of treatment, okay, most times people, depending on the environment, depending on other factors like the type of funding. Some people are doing out of pocket in different parts of the world. Most people, where there are no insurance services available, interesting, people even travel. I mean, travel from the Western world back to Nigeria to even seek medical attention. Okay, now that's talking about the cost of healthcare financing. So people who need to pay out of pocket, who need to pay directly for healthcare services, may have a challenge uh, coming for these services. Unlike people who are actually who are involved or engaged, registered with insurance, they can. It could be community, it could be state, it could be federal level, it could be private, and then they have better access to medical care. Now, lack of access itself, depending on the environment, there are people that live in rural areas where there is poor network, whether you talk about communication network, talk about road networks, water, so many other things, electrification, power supply, challenges. So these areas lack proper resources for healthcare services. So people lack this, and that may also account for reasons why some people are not actually disposed to seeking these healthcare services. Cultural beliefs, yes, it happens in some communities. Yeah, cultural settings, beliefs, the way it's been done in a family, done in a community, in a village, and things like that. Okay, so holding on to such beliefs that are actually damaging the individual's health could also be a reason. Look at people people get involved in use of herbs, traditional medicine, as I mentioned earlier. There is also the role of prayer, the religious aspect, seeking God's help, prayer, which is very important, but that should not stop uh, people's need and taking steps to seek proper medical attention. All right. Some people have suffered loss of babies because probably they were in a so-called prayer house where they didn't have adequate resources, medical resources to handle delivery of a baby. So sometimes um, this beliefs that you need to deliver at home, you need to deliver um, outside the hospital. People even talk about, in some places, talk about why they must not have an operation, and there are clear indications that this person needs to be operated. So, in such environments, people's health-seeking behaviors, with the kind of belief system that they have, they will have low uh, health-seeking behaviors. Another is mistrust in the healthcare system itself. People not having trust, even for those that are in the insurance, um, they are under insurance. Sometimes people complain a lot about how they are not receiving enough compared to what is being deducted or what they are saving for their medical care. So, according to the World Health Organization, actually one in four people globally avoid seeking care because of costs, even in countries with free healthcare. That's a staggering statistics. According to the World Health Organization, one in four people globally avoid seeking care because of costs. Wow, even in countries with free healthcare. Interactive. Now, be you have to be honest. Have you ever avoided going to the hospital because of fear or money? Let me know in the comments. Has it happened to you before? Because of fear, I don't know what is going to be found out, or because of finances. Have you ever avoided seeking healthcare services? What are your own reasons for, if you have any? for avoiding uh, orthodox medicine, seeking proper medical care, or consulting with a doctor? What are your own reasons? So, in different experiences, I've seen people present early for medical care, and they have had some significant changes or improvement, or a stop to a progression of a condition. Some people are actually coming at the pre-diabetic stage or pre-hypertension, hypertensive state, um, just around at a time that they could be helped to avoid progression to full-blown diabetes or hypertension. So such people will enjoy uh, the resources available. Okay, for example, talking about counseling, lifestyle changes that will be implemented, and for a few people, temporary uh, placement on medications. Okay, so this has done a lot to help a number of people, especially for those that even have risk factors like a family positive family history. um, Presenting early, even before symptoms start to appear, will go a long way. Then I will talk about why um, some people also have some unpleasant experiences. I've seen some people present with complications, some complications of diabetes, for example, retinopathy, retinopathy, um, the diabetic foot syndrome, uh, peripheral neuropathy, different organs, even the kidney, chronic kidney disease, so many organs being affected from having poor glucose control. Okay, so if a diagnosis is not made early, then there can not be uh, proper or adequate management. So when complications have set in, it goes beyond just treating or managing the condition to trying to address the complications. Okay, so that's one of the things that also happens. So what was it? What's that health test? What's that checkup? What's that investigation that you are supposed to do? I want to actually advise you to go for it. Okay, I want to encourage you to go for that test. It will go a long way. Interestingly, nothing might be found out. It might just be an opportunity for you to have a good check. Mm. So there are so many other factors that are helpful um, as life unfolds. Digital health, talking about telemedicine, which I also like. I like telemedicine. Now the availability of artificial intelligence, which is helping a lot, not just in the health sector, but helping people in different fields. Artificial intelligence, mobile health apps are also available. Uh, Apart from the machines that you can use for blood sugar check, for blood pressure check, there are also there are other apps for fertility. You know what you can use to monitor your menstrual cycle, hormonal levels, and things like that. These are very helpful applications that are available now. Also, in some areas, rural areas, the availability of health workers, people who may not really be at that level of peak of professionalism, but they are actually helpful. They are trained to help people with their health in rural communities. So technology is actually helping, and a lot can be done with technology. So, what are your thoughts? Health seeking is not just about the doctor. You may not even like the your current doctor. You can always switch. That shouldn't mean an end to your seeking medical care. Okay, so whatever it is that could be a challenge to you when it comes to seeking medical care, you need to address it, deal with it, and then move to doing the things that you should do to get the best of your health. So, what are your thoughts? Let me know in the comments. So, I want to encourage someone listening to book that session with your doctor. Go for those tests, and you will definitely find out that it's more helpful than just wondering what could be happening and all that. So, have you ever sought the services of a doctor? Have you been held by any medical professional at any time? Can you share your experience? So, are there other reasons that you know that why people have for health-seeking behaviors? Why people don't go to their doctor? So, I've just shared with us some statistics. So interesting that even in places where health is free, 1 in 4 persons still avoid seeking health care, medical care in the hospital. So in less than 10 minutes, about 10 minutes, okay, about 10 minutes from now, we'll be closing this session. So what are the other reasons you know that make people to avoid going to the doctor? Some people, it's because of a previous or bad experience with a healthcare provider. Somehow they avoid, uh, rather than probably choosing to get their services somewhere else, they avoid medical help completely, which is not good for them, for their own sake. So who is online? Online. So for those that are just joining in, you can watch the replay and replay the video as soon as it's available on the channel. Thank you so much for joining in. I'll catch up. We catch up with the community again soon. Bye for now.